record. All right.
By the way, do you prefer Bill or Dr. Croft?
Well, I mean, we're all respiratory therapists. It's up to you. I don't,
Oh, so we can call you Hey Respiratory.
No, that you can't do. That's my one pet peeve.
I almost got my name legally changed early in my career because it was like, really?
You're gonna get a response from everybody then.
Yeah, yeah, right. It's like, hey, respiratory. I was in the ER one night and I kept getting that. So finally I walked, and I had been working in this ER for I don't know how many months. Finally I walked up to the nursing station and I talked to the secretary and I said, hello, my name's Bill Croft. I said, I am with respiratory. I'd be glad to help you if you just call me by my name. Thank you. And from that point on, she never ever called me respiratory, because I just got to the point where I just felt, I don't say, hey, nurse. I don't say, hey, doctor. I don't say, I call them by their name. Mm-hmm. We've all had that experience. Yeah. All right. So you can see my screen now?
Yes.
Yes, I can see when system. Yeah, I can see your screen now, yeah.
Okay. Okay, so hopefully this will work and it won't lock up on me. If it does, it's just the nature of the business. So I've learned to deal with that, especially online. When I was in my classroom, I could easily just switch to the chalkboard. It's not the easiest thing to do when you don't have a chalkboard and you can't connect people when you don't have internet. That's sort of challenging. I'm going to move people out of my way so I can get that off the screen. Okay. So, all right. So just out of curiosity, I know y'all weren't, I know that Tricia was here, but James, Tracy, not Tracy, y'all were here. You weren't here last week, and this is Beautiful AI. I don't know if you're familiar with this or not, but this is the program that I use to present for a variety of reasons. Have you seen the under the synchronous sessions where it shows up? Have you seen that?
Yes, I watched it last week. Yeah.
Okay. Okay. Yeah, and the reason I use that is because, as you can tell, I can set it up where I can make this sort of continuous presentation, and it's much easier than trying to post each lesson or each section. So that's why I have it set up that way.
Okay.
All right, now I'm getting a circle of death again, so hopefully I'm not.
Sure. I mean, I can see your screen, but I can't see your picture anymore. But I can hear you okay.
Yeah, okay, that's fine. I don't want you to see me. I want you to see the picture, but it's not advancing, of course. Let me get this out of the way. Okay, maybe that's it. Come on. Why is this not moving? Ah, there we go. All right, so what we're going to talk about tonight is motivation, which is chapter 6. It talks about specifically, if you go to chapter 6, and the reason I want to do this is because this is really not well covered in this course, and I pushed it to this particular module because I wanted to get it out there early. So chapter 6 talks about compliance and motivation. We all know one of the problems with patients is compliance. Well, we have the same problem with students. Well, actually, we have the same problem with staff, to be quite honest with you. It's compliance with continuing education for staff. It's compliance with students turning in paperwork on time, just doing what they're supposed to do. And with patients, it's about their compliance and adherence to their care plan. And, what we want them to do is to be engaged, and we want them to actually do what we want them to do. The problem is how we approach it. So we have to think, and when I say student engagement, I'm talking about staff and patients as well. But in this case, these are just some of the factors that are related to engagement, things you have to consider, such as relationships, how that learning occurs in a relationship fashion for patients the same way. What dispositions to be a learner, in other words, what things that are influencing them to learn or not learn, what is their motivation and interest? If you have a patient that is not interested in what you're saying, you're not going to get anywhere. If you have a student that is not motivated, you're not going to get anywhere. For that matter, if you have a staff member, it's very frustrating for anybody who's teaching at any level to have somebody who's demotivated. So the goal tonight is to really talk about how to get them motivated. Then there's bring in the other factors such as the cognitive autonomy that goes along with cognitive theory. What is their self-efficacy? we'll get into Maslow's chart again, and then of course goal orientation and academic self-regulated learning, which, by the way, factor 8 was the focus of my dissertation, was how students self-regulated, or what we call self-directed learning readiness. The cycle of change. Everybody wants to change something, but most of the time people aren't thinking about change until something occurs. Now, oftentimes we'll see patients that come in who've had a heart attack or had an accident, drug overdose, whatever it is, and it shocks them into consciousness that they need to change their life. Well, students are not going to come with that type of shock and awe, but they might have lost a job because of NAFTA. We used to see that a lot. And that shock was enough to create them to start thinking about change. But they're still undecided. So they come to you and they're talking to you about getting a respiratory, or maybe they're a patient who's getting ready to talk about, I need to change, but they really don't know what to do. So there's this whole cycle of change. The problem with change, and this goes along with motivation, along the way things can get lost and that motivation dies down and this whole change cycle stops. And that's what we want to avoid. We don't want them to lapse or relapse back into whatever their behavior was that caused this issue in the first place. So these are just things that we have to consider in the change process. Ultimately, we want compliance, but we can't force compliance. Most of you are aware that, well, I know Tammy, you're obviously a manager in a department, so you probably have all of these things going on. And how do you get your staff compliant with all of these things? I deal with laws and rules. And of course, you as managers or educators, you're having to implement policies and regulations and standards to meet those laws and rules. It almost seems like a battle that you're constantly fighting and wondering how you could get there. How can we maintain compliance? Of course, that's why Joint Commission exists, is to ensure that you do. But nevertheless, in education, we're trying to get them to become compliant with all of these things. Now, think about how this could influence an incoming student to look at all of this. They would be scared to death that they couldn't accomplish what they needed to accomplish. And if you do get into education, you will see that quite often. And the problem is they've never had to deal with all of these factors. But that's what a profession does, right? I mean, we're constantly dealing with compliance issues. And it's not to say that people are non-compliant. They want to be compliant. The problem is they don't sometimes know how to be compliant. I deal with non-compliant people every day, unfortunately. And, you just want everybody to do the right thing, but sometimes they don't know what to do. So compliance, you got to yield to the recommendation or the will of others, which people a lot of times don't want to do, and we see that a lot today. The motivation is the biggest factor that I think we need to look at, and then adherence to that will depend on whether or not they're motivated enough. One of the things that I used to tell my faculty, I was a department chair of a health science department, we had 7 programs, is if I could measure desire, then I could predict which students were motivated enough to complete the program. And we actually were able to accomplish that to some degree, because we would put requirements in the program that they would have to achieve, and those requirements stimulated them enough to keep moving. There were obviously students that didn't, but the majority of them did. And one of the big projects I worked on was, I was a minority male mentor for our college. I worked on the diversity committee. And so I was really interested in minority male success in health sciences. And the reason was we had in North Carolina only 5% of the total population of health sciences that were minority males. 5% out of almost 10,000 students in the entire system. So we developed a plan that would to increase success levels, and they had to meet the same requirements, don't get me wrong, but we made sure that we focused on what their needs were. And the majority of the time, when you looked at the other schools, there was about a 25% success rate among minority males. we had a 75% success rate among minority males. The difference was we had a standard, we helped them achieve that standard and maintain that standard, but they did all the work. And those were really exciting things to get involved in, particularly because one of the things that we had a real problem with at our school was that most minority males would not even approach any health sciences because they felt like it was too hard. We convinced them otherwise, and they were successful. All right, so Maslow's chart. Now, one of the other factors we talked about last week in learning theory was the fact that these factors play a part in a student's success as well. So if a student comes to you and is homeless, do you think they're going to necessarily be successful in your program, or maybe even as a staff member? Or as a patient, if a patient comes to you and they have a care plan that they have to implement, will they be able to implement that care plan if they are worried about the roof over their head? Will that be a priority?
Not in the least. They're worried about the basics.
Right. So we can't solve these problems a lot of times, right? But we have to recognize the problem and help them get to that point. You know, we would see these things. And so what we would do is, after talking with the student for a while, we would go to the resources that are available to us on campus, and we would try to help mitigate those as much as we could. The faculty are not equipped to help them with housing or childcare or those kind of things, or a car, but there were resources on campus that were. So our goal was to make sure that we address these needs, but also to identify and assess these needs early on. And the biggest way, what's the number one way you can get to these needs, whether it's a staff member or a patient or a student? Anybody?
Probably ask open-ended questions.
Correct. So you've got open-ended questions. You have, you know what? I'm hoping I am hoping I'm recording this. I just realized that I may have not done that, but I'll record it again.
You
Okay.
are. It's a record.
Okay, good. Exactly. Open-ended questions. But the key is, and I said this last week, conversations. Okay. Having that conversation is important. And in that conversation, using those open-ended questions. So we talked about obstacles to learning last week, and those motivational axioms, which you are in chapter 6, talks about the set of rules for motivation: anxiety, learning readiness, realistic goal setting, learner satisfaction, uncertainty reducing, or uncertainty maintaining dialogue. So in other words, we want to reduce their uncertainty through the dialogue or through the conversation. Every portion of these motivational axioms was part of my dissertation as well, because we talked about with learning readiness, part of learning readiness is to understand that they have goals that they want to achieve, but then are those goals realistic? Are they measurable goals? You know, I want to be the best respiratory therapist there is in the world. I mean, okay, I have had a lot of students that's what they said, but that's almost an impossible legacy to live up to. Who's the best? And I, you know, quite honestly, you know, I think all of us want to be the best, but I think we can all be our best, but not be the best. And I think that's the problem, is that sometimes that motivation can spin off into demotivation if they think that they are going to be the best respiratory therapist in the world and they're going to get all this recognition. I have had people tell me, I work so hard and I never get recognition for what I do. And you've probably seen this in respiratory therapy all your life, is that you have these people out there that are just simply, they want somebody to motivate them, and rather than them motivating themselves to achieve something. And that's not realistic. I mean, that's not a real, and if they want to move up, you're doing exactly what you need to do to move up, is you're getting an additional education. Have any of you ever talked to somebody that just sits around and complains about it but never does anything about it? Which is about probably 80% of the people, but what do you think?
I do, and I usually tell them, I said, you're going to complain, bring me a solution.
Yes, exactly. I just noticed my screen is stuck and my face looks like I'm screaming, but I'm not. Okay, so yeah, I mean, there's so many people out there that want to achieve something without doing something or without making a plan. And I think as educators, our goal is to help students understand how to develop that plan. If we're teaching a patient, we need to help them develop that plan. But we need to know, what is their readiness to learn? You know, are they in denial about certain things? In other words, are they in denial about what they can and can't do? It's not about, that they don't have a skill yet. It's about, how can we develop that skill? And a lot of times they see, well, I don't have that skill, I can't do that. Well, how do we develop? Number one pet peeve with me with my students, and it really annoyed me, was the first sentence out of their mouth was, I can't do math. And I said, and I always reflect on my mother, and she would always say, you can't, never could. And she was right. I was terrible at math in high school, but and I'm not bragging, but I was exceptional in college, not because I was exceptional, but because I had an instructor that recognized that I needed some help with just a few things, and it made all the difference in the world. And I fell in love with math, and I became very good at math. And sometimes it's just about people helping them recognize those things to help motivate them. So the question is, are you ready? Is your student ready? There's this sort of concept called PEAK, which talks about the physical readiness, experiential readiness, emotional readiness, and knowledge readiness. And it goes back to andragogical principles of Malcolm Now's, which, he talks about structuring work according to the person's experience, based on, because everybody has experience, you bring that to the table. So, what's their, using their experience, using their background, using their locus of control, their orientation, to help draw from that, to help motivate them, or their motivation from an emotional standpoint. The reality is if they don't have a really good, let me get this out of the way here. If they don't have a really good support system, are you still with me?
Yes.
Okay. My circle of death came back, so. And nothing is responding.
I can still hear you.
Okay. My program is continuing to go on without me. Okay, very good. All right, so the emotional readiness, what's their anxiety level? What's their support system look like? What is their motivation? Do they have risk-taking behavior that might influence their ability to learn? What is their knowledge readiness? What is their present knowledge base? Cognitive ability, learning disabilities, do they have any? Do they have ADD, ADHD, dyslexia? I mean, really, there's not a whole lot we can do about their physical readiness, but it helps to know whether or not they do have those physical issues that might somehow influence their learning. One of the things you need to really know about is, what is their locus of control? And locus of control basically is, are you internally, in other words, are you self-motivated internally, or are you externally influenced? You will find the best student is going to be that person who is internally motivated. The problem with that person sometimes is that they're so motivated that they may not follow direction as well, because they know it all. The external locus of control may not even, they rely on others to give them feedback. So they're sort of spinning their wheels and waiting to be instructed upon. You tell me what to do and I'll do it. They just don't have any motivation unless it's externally driven. So knowing their locus of control, I prefer, of course, the internal locus of control, because I want somebody who's internally motivated to achieve something. But then you sort of have this back and forth between, there are certain people that, yes, they have that internal locus of control, but they're influenced by those external factors that can push them down. Motivation for learning. So when we take all of this sort of into together, we've got their motivation for learning. All of these factors come into play. And we have to look at those and see if, you know, again, this would be more like a one-on-one type thing that we would be doing with a student, like an interview or a counseling session that we would be doing with a student, and to really explore these things, to find out through questions, are they internally motivated? And again, that comes from asking those open-ended questions, but not telling them they are, but simply sort of evoking that information from them. So we're going to talk a lot more about assessment in the coming chapters, particularly with determined learning, and we're going to get into the formative assessment cycle. And I'm just going to mention this right now because I wanted to bring this to the fore, that part of your assessment of the student is going to be looking at all of those learning factors, but also realizing that assessment can be for learning. In other words, you can assess their learning, but it can also be for learning. And what do I mean by that? When you formatively assess a student, a self-evaluation of a student could be useful for them to reflect upon, maybe with a peer review, to help them learn. So they assess for learning. In the end, we're going to assess their learning, but you get them to assess for learning first by challenging them to do certain things, whether it be a test or whether it be whatever. And you come up with a way for them to crystallize what they need to change in terms of how they're going to, maybe how they're learning something, or they didn't learn something, how we can adjust that. But I used to do assessment for learning all of the time, where I would give them an assessment of some type, whether it be a written a test or something in the lab, and then I would have them self-assess. And then I would ask them, tell me what you learned about yourself today when you did that. And this helped them reflect back on and self-evaluate. It's really important in the educational process to do that because, we just talked about learning styles. Well, this helps reveal maybe what is best for them, but you get them to do it. As Tammy mentioned earlier, get them to do it rather than you do it for them. We're going to talk a lot more about that in coming sessions. So I really wanted to just touch on this last part, which is motivational interviewing, which is in chapter 6. Are you still with me?
Yeah, I have a quick question if you don't mind.
Go right ahead.
So supposing you have to teach a group of people who are not motivated, like health stream or compliance training, they're just not motivated, they don't want to learn it. How do you address that?
Well, I'm about to talk about that specifically, but here's what I would do. First of all, what size group are we talking about?
I guess I'd say like I don't know, 30 people or so.
Okay, and they're completely unmotivated, right?
Yeah, like they have to. They're doing this, like let's just say it's an ethics training class, and it's like, oh, this is stupid. I don't want to do this.
Right. Well, I think that's where, one of the suggestions I make to a lot of groups when I go speak, and I really prefer to do it this way. You've seen TED Talks, right?
Yep.
Yeah. Okay. What is fundamentally, what do they do in a TED Talk that's different than any other lecture you go to?
Well, let's see. I mean, they do kind of try and bring the audience in by involving them.
Exactly. So what do they do to do that? What's the first thing they start with?
Attention grabber.
And that attention grabber is what?
Questions sometimes.
Sometimes, but mostly it's a story. It's a story about their topic, and they just kind of launch into it. And what it does is it draws the audience in. So when we're talking about something that somebody's maybe not interested in, you've got to find that, what is the hook? What is the one thing? In other words, why are they here? Who are they? What are they? Why are they here? These are all things that we want to know. In other words, why are they coming to take this ethics class? Because they're required to. And if they're required to, is it part of their professional obligation to do it? I mean, just give me a little idea. What's their requirement for?
I remember that when I went through RT school the first time, it was like, you have to take this
Okay.
ethics class as a state, the state requires you to do it.
Gotcha. Okay. Yeah, I hate those courses. I hate them myself because they take, they sort of, they take a really dry approach to it. And how I would handle that if I was teaching it is, first I would come up with stories about ethical dilemmas that we would discuss and get them involved. And even if they don't care about ethics, they would probably be okay with talking. And that's okay, because the whole point of them talking is to get them to get engaged, because what we want them to do is relate to the material. And the only way we can do that is to get them interested. We could just give them a PowerPoint and send them on their way if it was just about, getting through the class. But if we really wanted to teach them, then starting with those stories, just so you will know, when I go speak to an audience about something the board is doing, that's what I do. I go into a story about how something happened. I go in maybe to the history of it a little bit, something that I feel like might be a hook for that group. And I don't try to beat them over the head with material, because I got to get them interested first. And a lot of times they're at those conferences to get CEs, and all they care about is getting the CE. They don't care about what I have to say, and I realize that. So I try to use that, and I begin with a story, and whatever it's related to. I did one on laws and ethics, as a matter of fact, at the last one. And so what I did was I took cases that we worked on, and I presented the cases and asked them what they would do, and then about that violation and what code did it violate. And in other words, I let them sort of teach themselves. They just didn't realize it. And that's what I would like to do here. Unfortunately, there's a little bit of a conceptual issue of not being, sitting around a table, which is a lot easier if we are. But that's sort of how I would engage them that way. And maybe it won't work, I don't know, but that's what I would attempt to do anyway. Does that answer your question?
Yes, it does. Thank you very much.
Sure. So self-determination theory, which is part of chapter 6, talks about, the three things that people need. They need to be able to relate to each other. They want a certain level of autonomy, and they want a certain level of competence. Now, think about that. That's a respiratory therapist. They want their autonomy. They want to show their competence. They need to be competent to be effective with dealing with their environment. But they also want to have that, they have to have that relationship, that relatedness to other people. And, and here's the thing. Have you ever, your most successful therapists are going to be the people who relate to other people in a very common way. They're not just there to show off and be the best therapist. They're there to be part of the team. And that relatedness is important. But if we're missing any of those three, it can be problematic. A lot of therapists leave, for example, hospitals because they lack the autonomy to do their job. And of course, some leave because of competence, because they can't do their job. Whereas others, it's a behavior issue. They can't relate to others very well. Yes, I'm a great respiratory therapist. I can do my job. I've had people tell me, I actually had, just to give you a quick story, I had a therapist last quarter that ordered a protocol on a patient, signed off a doctor's name, and never talked to the doctor, implemented the protocol, and decided he thought that was a good thing to do because the patient, it was the best for the patient. What was he doing?
Practicing without a license.
Well, he was practicing medicine without a license.
Yeah.
And I asked him that very question. Well, what were you doing? He goes, well, I was doing what's best for the patient. I said, no, you were practicing medicine without a license. It was at that point, it hit him like a ton of bricks. And I mean, you could see it, his blood just drained from his face. Yeah, he may have had good intentions, but he did the wrong thing. And the doctor was not happy, by the way. Neither were the physicians on our board. So in motivational interviewing, I mentioned last week, and I don't know if you caught it, I used to teach mindfulness on campus because that's part of my training, where I would teach how to be mindful in different processes. And I did a mindfulness and educational process. But motivational interviewing, which is in chapter 6, is a mindful process. That's why I love it so much, because it will help bridge gaps between your patients or your students or your staff if used correctly. The other thing, as I always tell people, is when using motivational interviewing, just breathe, because what it is you have to allow these things to occur within the system of the process. In other words, don't force anything. It's just relax, let it happen. When I used to do, when I was working on my dissertation and when I had my case studies and everything that physical patients I was working with, um, one session of a patient would take 1 hour, and the minimum number of sessions would be 8. So a total of 8 hours per patient or per case or client, however you want to call it, was important to help at least start the change process. 8 hours, that's the minimum. How many hours are spent teaching patients how to do disease management in most cases, or how to engage in disease management?
15 minutes in a doctor's office.
Not 8 hours, right?
Yep.
No. If you want to do this right, you have to take time to do it. So the benefit of MI is really to shift compliance from dependency to self-care. But that self-care is still a partnership between the provider and the patient. And that's where we get to a much greater adherence to therapeutics. If we're talking about patients, if we're talking about students, we're talking about a compliance and compliance to their plan of study. So we can change up the language to fit whichever the category we're talking about. And if it's a staff member, it's the same thing. So there's something called this, and I've written on this extensively, the spirit of motivational interviewing. The spirit itself revolves around, you'll see it's all acronyms, ACE, autonomy, collaboration, evocation. This is sort of the idea is to convey that the patient or the staff member or the student has an autonomy that they can develop but through that collaboration process. During the process, we have to be aware that we have to simply roll with the punches. We can't force anything. We use our oars, we'll talk about in a second, and then also look at things like when they reach the level of change talk, when they reach the level of commitment, then we can get behavior change. And what's really exciting is to see someone shift behavior as a result of this process, but it cannot be forced. As a matter of fact, the way this works is you will spend most of your time engaging and focusing to begin with. And that might be the first couple of sessions, because you have to gain their trust. You have to give them information to create in other words, to focus them, to help sort of stimulate them to want to change. The evoking process is when you get those answers to those questions that tell you they're ready to talk about change. And that's what really becomes exciting. I've got a whole presentation for MI in the second part of this, and it's a bunch of videos of how the MI process is done. This is just sort of an overview. But before you can ever plan, because what do? We walk into a patient's room, we have a plan. We haven't done any of these things. And we expect that patient in 15 minutes to do and adhere to that plan. We do the same with students a lot of times. We give them a syllabus, and we haven't done the other 3 things. Well, hopefully we have, but at a graduate level, we're not worried about that too much because you've done that yourself. But we're talking about at undergraduate level, we may have to get them engaged and get them interested and get them motivated. So there's some rules in motivational interviewing. Resist telling them what to do. understand what their motivation is, listen with some empathy. You don't have to agree with everything they're saying, but understand that that's their perspective, and then ultimately you want to empower them. And so these rules are designed to help you focus on the fact that we're not trying to force this any change. The change has to come within, and remember that their locus of control may determine how that process is completed. So the core skill, you have to have your oars in the water. Open questions, affirmations, reflections, and summaries. And what that looks like is this. So you all know what open-ended questions are. Now, here are some examples. I don't like these particularly, but these are open-ended questions nonetheless. How do you hope your life might be different 5 years from now? That's a common one you might ask as a manager. What I like to do, instead of asking them necessarily a question, I will say, tell me a little bit about how you see your life in 5 years. I want to sort of invite them into it, because when you start asking them questions just like that, you tend to get people resisting. So I tend to phrase it as more action verbs. Tell me a little bit about how you see your life in 5 years. Can you expand on that? These are all things that you can come up with, but the key is obviously not to ask a yes or no question. Let's see. But what's really important is to keep those as our instructor. Just so you'll know, I took a whole course in motivational interviewing, so I get really excited when I talk about this, and I can't touch on it enough. But what she said to me was really important. She says, keep your oars in the water, meaning that you're constantly going to be going back and forth in the water, just like an oar would be. And so you're constantly going back to a question, you're affirming that you understand, you're giving them some reflection, you're not repeating what they're saying, but you're giving them a reflection, a paraphrase of what they said, so they know that you understand. And then you help them try to pull that together in the final analysis. And this whole thing is designed to help them get to their goal. And these are just some of the questions that are sort of ideas of how you might approach that. So you would ask. The key here is asking permission. When I would, a student would come to me and say, "Well, can we talk about, or maybe we talk about, your situation? Are you ready? Are you ready to do that?" And a lot of times they'll say, "Yes, I am." And I said, "Well, sit down. Let's have a conversation." So, and then we would just go in, I just let them talk. And the more they're talking, the better it becomes, because then I know what questions to ask. If they're not asking any, or if they're not talking, it's very difficult to ask questions. What I do from now in my career is I ask a lot of questions of a lot of people, because I get obviously complaints, and I have to deal with that. And we have to be able to we have to extract information, and the way to do that is to ask open-ended questions. And sometimes we have to ask those closed questions so we get to the answer that we need. Remind me sometimes, I'll tell you how we do that. But in the next section, this is a whole series of videos on how to do MI. And I think just from a career perspective, spend some time looking at this, because I think you'll find it beneficial. But keep in mind, this is going to be a one-on-one type system of getting to that learning style of that student, trying to help get them over that hump, or a staff member who's struggling, or a patient. For me, using it with patients is really helpful, because it's more like, if you've ever gone to a counselor, a psychologist, they've probably used this method, and you probably didn't even know they were doing it. But this is part of what you learned in psychological counseling, but it has wide application for respiratory therapy. I'm going to share my article I did on motivational interviewing for chronic lung disease patients that I wrote several years ago with the group. But I would encourage you to look at those other videos that I'll post along with this. So any questions? Y'all still with me?
Yeah, I'm with you.
Okay. Tammy, are you still there? Tricia?
Yes, I'm here.
Okay, I cannot see you. That's my
Yeah,
screen.
Oh,
I don't think
looks like
Tammy's here.
Tammy, looks like she left.
Okay, okay.
Prof, can you just kind of clarify on the journal aspect of the final that you wanted us to do?
Uh, Wait a minute. On the
You know, the journals, we're submitting them weekly?
yes,
Is that okay?
yes.
Okay.
I didn't know if you were talking about the assignment for this week or last week, but you're talking about the actual journals.
Yeah, so
Those, as far as I know, as far as I understand, because that's sort of a continuous journal that you keep about your final project. And as you go through each course, you're adding material to that relative to the course you're taking. So I haven't had a chance to look at yours. Actually, I haven't had a chance to look at anybody's because I've been grading papers, but because I usually get to that next. But you're going to be writing on that final project and how you can, I know several students approach it different ways, but you're building basically a base of knowledge that you're going to be implementing. Now, it doesn't mean you'll have to use it. It just means that, you know, you're journaling on the topics relative to your final project and using the information you're gaining from the course. Does that make sense?
yeah, so it's like a weekly reference that what you're learning during the week and just kind of applying it to what you want to write about for your final.
Yeah,
Correct?
if you'll tell me real quick, what is your final project?
I was thinking of trying to kind of do a NICU protocol, but in a way to teach staff on
Okay,
the
all right.
protocol.
All right, that's perfect. All right, so I think you wrote about that in your discussion forum, right?
No, this is something different. That was actually a NICU training program that I discussed in the forum, but what I
Yeah,
part of what I want to do for the final is just write about the protocol and how I would be able to first develop it, but then after developing it, how would I be able to kind of present it to the staff um, and how I would be able to incorporate that so that it could be implemented.
okay. So everything you're learning regarding learning applies there because you know, as well as I do, some of these courses for, particularly when you're talking about, you know, resuscitation or any of those kind of, they get sort of canned and people kind of zone out and they just want to get the information, take the test, and get their, you know, get it under their belt to say I did it. So you have to be creative. To going back to what James was asking about was, you know, if somebody's really not that interested, I mean, they're going to be interested enough because they want to pass the test and they want to get their certification. But in this case, you're talking about a protocol, which you know they will be using, correct? And
Yes.
so that should be easy enough. The question is, how do you present that to them in a manner that will, one, help them learn, but also be interesting? And, you know, looking at the different ways to stimulate their thought process, you may have to change it up based on, you know, the particular part of the topic. You know, I'd have to look at it to be honest with you, how I would possibly do it. But that is also going back to how you feel most comfortable presenting it too. You know, because if you're uncomfortable maybe with, we're going to cover at a later date. Have you ever heard of a pechagucha? Are you
No.
familiar? Okay. So a pechagucha basically is a short presentation of 30 slides in 7 minutes. Now that sounds like a lot, but the goal is to, I call it riffing. Or maybe if you go to like a poetry reading, you know how they sort of get really into it and they start riffing on the information and it almost becomes a rap, so to
Yes, I think
speak.
I read on this. I think I read on this for the
Yeah,
last week that we did. Yeah.
and it's really kind of cool because it makes it a lot of fun, you know, and coming up with something along that lines where you would have to construct it where the timing was just right, but you probably would get a lot of acceptance because it's going to cut to the chase on what they need to know, and you know, as opposed to dragging it out for slide after slide after slide. But because it's so fast, and it has to go back to attention span, and how much people can information they can absorb, and they can absorb a lot more information a lot quicker than we give them credit for. And the problem is that the speaker feels like, and I'm guilty of this myself, we have to tell them everything, and the reality is we don't. And so you would have to develop it in a way that could capture everything you want to capture. And most of that's usually done with pictures, and usually no more than 1 or 2 words per slide. That's why you have 30 slides, because it's very minimalist. Yeah, we had a lot of fun with that last year. So
I'm sorry, do we use the journal then to kind of communicate with you on
Yes.
what we're doing and how we're doing? So
Yes.
we're just sharing that Google Doc with you, and then you'll be able to communicate with us if you find something.
I mean, exactly. So I would just give you feedback on, here's what you might want to think about doing,
Okay,
or consider. It's a journal. It's not right or wrong. It's, well, if you don't do it, it's wrong. But I mean, it's just about learning. It's about journaling it so you have that documentation, and you can reflect back on that documentation later, and you'll change it. That's fine, but you have that to reflect back on.
So the material that you want us to keep in the journal, is that only stuff that has to do with final project, or can it be like, my kid is really sick today and so I'm not sleeping, or I mean, what kind of stuff do you want to see?
Yeah, relative to the final project, I mean, you can certainly share things if you want to with me, if you want to do that in an email, but I wouldn't share them there. If you're having trouble with something, certainly share that with an email, and we can have a discussion. But no, the journal is really specifically for the academic work.
Okay. Let's see, I had a couple, I'm sorry, Tricia, you finished?
Yes, I am. Sorry, I was just listening to you. Yes, I am.
Now, one thing was the assignment this week involved like 3 chapters in the book, and that's like 150 pages, that's kind of a lot for 1 week. And do you have any advice on, like, should we just tailor our reading based on what the assignment is, or how do you want us to?
Well, what I would do, that's exactly what I would do first, to get to the heart of the matter. But what you want to do, you got chapter, 6, 10, and 11? Is that what it is? I think, because the majority of what you have to do this week, I believe, comes from 10 and 11. So here's what I would do is read as much as you can of each chapter, but specifically target the area that you're actually writing on, if you have the opportunity. Now, just so you'll know, a lot of these, a lot of the chapters have charts and graphs and all that, so it's not quite as long as it looks at first. Certainly you got 467 to 501, but that includes the references, that includes all the charts and the pictures and everything else. But yes, I would tend to focus on those areas that are that you're actually utilizing in the actual assignment. And right now, unfortunately, I can't do anything on my computer other than talk to you to give you an example. But see, I believe, correct me if I'm wrong, you're doing teaching methods. What teaching method you're going to do? Is that the assignment, I believe? I have to go back to.
Wait, I'm sorry, for the chapters in the book?
Yes. No, for the assignment. I can't see the assignment right now because my computer's on this end is frozen.
Oh, I don't remember what it is exactly.
Okay. Well, again, I think you're on track. Obviously you're not going to be able to, read it entirely, but what I would at least do for each of the chapters is read the introduction and the summary of each chapter first. And then for the topic that we're writing on is to go ahead and maybe dive in a little deeper there. You'll have to, and use your book as a reference, okay? It's not necessarily meant to be read end to end, but it's a reference material more than anything. And I mentioned this last week. In my doctoral program, we had 2 books, our statistics book and our education book. And that's it. Everything else was done by journals. So we read and read and read, but the advantage was, you know, with journal, just like you do with a journal, do you read every part of a journal article when you read one?
Um,
You probably read the introduction and you read what their findings were, correct?
yeah.
Okay. And then if you have a question, you dive into how did they do the study? You know, was it a was it a randomized controlled trial? Was it a double-blind crossover study? Was it, observational? Because, those are the kind of things you look at, right, to see if it's valid or not. But the reality is, if all you want to know is what is the bottom line, you read the intro and you read the summary, and then if it interests you, you read more. So use your book more as a reference guide to get the information you need to complete the assignments. And if you do that, then you'll get through the majority of the material without having to go straight through all the reading. But I would at least do the introductions, get an idea of how the chapter's laid out, and read the summary so you know where to get that information.
Okay. All right. Let's see. On the assignments, when we turn in an assignment, do you want cover pages and running heads on all of our papers?
Well, I was talking to Dr. Coster today about that, and we're going to use the professional style, which would require a running head, but don't use the word running head. You just put it at the top. And just so you'll know, I think I've already graded your paper. Yeah.
Yeah.
And in the PDF that's there, it shows you the things that you need to correct. It's not a big deal. I mean, it wasn't bad. It was just all the things that probably need to be addressed. But 4 pages, that's the whole page. All right. So if you have a reference page and a title page, you actually have 6 pages, right? So because it's 4 pages of the body, and from introduction to the discussion or to the summary. So it's not 4 pages including the references and the title page. It's 4 pages of the body.
Okay. All right. Let's see. And then I thought I read somewhere in the on the website that there was some kind of a project that was due. But
Yes.
okay. Is that when you said that, were you talking about the journal articles, or were you talking about something else?
No, I was talking about, there is a project at the end of the course, basically, is where you have to have the material. In other words, you're developing a final project for this course, but you also have a final project for the program. All right. So in the final project for the course, you're going to be developing it's whatever topic you want to choose. You're going to use the information to develop a course of study or a lecture, if you will, on the topic that you choose, utilizing all of the styles and theories and things that you learn. You don't, obviously not going to have to use all of them, but you would implement that. You're going to record it and you're going to present it in the, in Blackboard. And so you'll post it so people can review it. And then after everybody reviews it, then I'll review it. So forth. So that is the final project. Let me see. I don't know if I can pull that up. Let me see. No, I can't. My computer's just.
Yeah, I didn't see it, but I probably was just kind of rushing through it. I'll probably.
Well, I don't have the electronic copy. I have my working copy of my syllabus, and I'm just trying to think. I don't think in the syllabus it explains it in the module. If you'll go to trying to find it here. Yeah, I got to get online to be able to see it. Unfortunately, that's the only problem. And what I will do is in the morning, I will shoot you an email and just highlight where it's located in the syllabus and in the modules, because right now I can't see anything.
Okay, great. Thank you.
All right, no problem.
And then let's see, I think I had one more question, and it had more to do with like class material, like learning material.
Okay.
In the book here, it talks about ego defense mechanisms, ways of protecting the self when perceived a threat, right?
Uh-huh.
Okay, so you know, I know that health professionals, they always have to have some kind of ego, because if you didn't, then you know you'd be like, oh, I don't know if this is right. What should I do? You kind of have to have that. So when you had someone like the guy you were talking about, where it's like, you know what you were doing, you were practicing without a license. I could really see how somebody would, somebody's ego defense mechanisms would kind of start to distort reality and go like, you know, oh, I wasn't practicing without a license. What did they expect me to do? I have to take care of the patient, don't I? You know, and kind of rationalizing everything, and thereby kind of, you know, altering reality on what actually happened. Does that happen, and what do you do about it? I mean, like if that were
Yes,
me,
it happens. and that's exactly what happened. They can't self-regulate when they're ego driven. You know, you're familiar with the id, the ego, and the superego.
yes.
Well, the id lashes out, and that's what happened as well. He lashed out against his coworkers because they called him out on, you know, he was so myopically focused that he thought he was doing the right thing. He didn't have that super ego intact that would critically analyze it based on the social norms. And so he couldn't self-regulate that behavior. He thought what he was doing was correct. Now, I'll have to sort of say that he was allowed to be that way by his managers for so long until he actually overstepped the bounds. So there was reinforcement of that behavior, unfortunately, that ultimately caused it, but it was still his responsibility. I mean, we can't put it on the manager, but it's something that should have been dealt with a lot sooner, and it wasn't until it crossed the line. This is not the first time it happened that I've seen that happen. I've seen it happen multiple times. In one instance, a patient died because they failed to turn the ventilator on. And their ego would not allow them to see the error that they made. And what had happened was he received the patient from a transport, he had transported the patient, I should say, from one part of the hospital to the other part of the hospital. But because it was a hospice patient, they were doing palliative care. So they elected to turn off all the monitors so they wouldn't disturb the family as they moved the patient to the step-down unit. Well, the problem is they never took the ventilator out of standby.
Oh.
So the patient wasn't being monitored because their policy was not to monitor that patient in transport for the patient comfort. But the patient for 20 minutes was breathing on a ventilator in standby. The patient dies 5 minutes after the delivery to the step-down unit. And the person involved tried to rationalize that he did what he was supposed to do because he had him on the ventilator, he was monitoring, he was breathing. Well, he had chest movement, I'm sure. The question I asked him was, what were the breath sounds? And there was silence. Because all you would have had to have done was check breath sounds, you would hear no air movement. You would feel the chest move, but you know, the problem was the patient was also heavily sedated, which didn't help. So, you know, and it wasn't paralyzed, but it was heavily sedated. And so, yeah, I mean, there's nothing you can do about that at that point. I mean, it is what it is, but when you get to the point where you're trying to correct that behavior, you have to get their ego out of the way and help them understand, you know, and help them self-evaluate so they can figure out what went wrong. because this person was a good therapist in this case. The other person was a good therapist, but he thought more of himself than he probably should have. This one was really a good therapist who made an awful mistake and couldn't come to grips with that. So, I mean, it's a very different scenario, two different scenarios, but ego was involved with both. And unfortunately, what we can do from a regulatory side is, and we did with both of these, is put them under a consent order and monitor them and have evaluations done periodically to make sure they're operating in a way that's safe. You know, the same could be done if it's a student who gets off the rails because, you know, they're doing the right thing, they think, and, you know, they're doing everything they're supposed to, but yet their behavior, their ego is not allowing them to accept maybe their faults. And that's somebody with a really strong internal locus of control, but it has been developed in a manner that is unrealistic. So what we have to do is bring that student down a couple, I don't want to say down a couple of notches, but we have to bring them to reality and help them understand that they have to change that behavior. And sometimes we would have to engage in a contract with them so they would keep on the straight and narrow. Now, in my environment, we do a legal document called a consent order. We would do a student contract in the student scenario. It's kind of difficult to do that with a patient, but we can find other motivating factors there.
Okay. Yeah, so like a contract, that might be it, because I know there's some people out there who's like their ego is so big, you know, there's just no convincing them, even if they did something that was obviously egregiously wrong, there's no way to convince them that, you know, you just can't do it.
Right. Well, true, but you know, of course, I'm in a position where they kind of have to, because if they don't, they lose their license. But, you know, I've had students in those scenarios that I would have to do that with, and then eventually they would, because of behavior problems, would have to, you know, would be asked to leave the program. I was one of the few program directors in the state that actually dropped people out for behavior. And they would always ask me, how do you do that? We can't, they won't let us do that. I said, if you make it clear what that behavior is and you document it and you get everybody involved that's supposed to be involved and don't let it go, you can, in most cases, convince that person this is not for you. It's easier to do that with a student than it is for a staff member. But with a staff member, you know, I'm assuming that's what you're talking about. With a staff member, you know, it's not just their job on the line. It could be their license on the line, you know, and, you know, in North Carolina, we have a very high adjudication rate. So meaning about 80% of the people that we see that we actually take some action on. And we engage them with these contracts all the time. In some cases, their behavior changes. In some cases, it doesn't. And you can't change everybody, unfortunately. Their egos are too big. They can't accept it. And the most common ones we see fail are those with substance use issues.
Oh, okay. All right. Well, thank you very much. I'm out of questions.
That's okay. I've got to try. Hopefully, when I close this out, I'll be able to. Still, my app is still circling. I still can't see anything. So I'm hoping it says not responding, and now it says responding. Okay, that's interesting. Anyway, you have a good night, and we will see you next week.
Thank you.
All right, take care. All right, take care. All right, bye-bye.